One of the most common questions that we get is treatment options for the lower eyelid. Two treatment options that we offer include a chemical peel, so 35% TCA chemical peel, and ProFractional laser, erbium resurfacing. And so with those two treatments, we get a question often, which one is doing more, less, what are the recovery, what are some of the differences? ProFractional is a fractionated laser, meaning it's only treating a percentage of the skin. We can range that from 5% to 44% or kind of anywhere in between. Chemical peel, conversely, you're treating 100% of the surface area, and it's sort of a less precise, but it is a stronger, more aggressive treatment for the skin. So in terms of more aggressive treatments, I put the chemical peel above the ProFractional erbium laser. Okay, and so those two things definitely have different expectations. Duration of benefit for each of those treatments that were talked about for resurfacing of the lower eyelid. The profractionated erbium laser is something that I think of almost a little bit closer to more of maintenance, right? You're doing that more frequent. There is less downtime and less recovery, so you can do something a little bit more regularly. For the patients who don't have that downtime, maybe that's something that you're doing on an annual basis, right? So maybe once a year you're coming in and we're doing profractionated resurfacing to the skin of the lower eyelid. And that can be, increased and be a little bit more aggressive one year to another, depending on sort of the needs of the patient. As far as a chemical peel, how often to do that, I usually tell patients maybe every 2 to 3 years. Okay, and that's when you're getting, a little bit more duration and benefit out of a treatment that's a little bit more aggressive, but still in that 2 to 3 year range versus erbium or CO2 full field ablative resurfacing. You're looking at something that you probably don't need to do until maybe 5 to 6 years passes. So each of those have sort of incremental duration benefits. They also have incremental recovery and just tolerance in terms of kind of the procedure in and of itself.